Welcome to today's briefing on the state of play, U.S. foreign policy on sexual and reproductive health, rights, and justice. My name is Seema Jalan, and I'll be your moderator. I'm the executive director of the Universal Access Project at the United Nations Foundation. And before we get started, I wanted to set the scene and explain a little bit of why we're having this briefing now and why it's such a pivotal moment with the U.S. administration and Congress. So the ingredients for real change are coming together. It's a combination of mandate, leadership, resources, structure, and accountability. So starting with mandate, in one of his first public statements, US Secretary of State Anthony Blinken noted the centrality of sexual and reproductive health and rights to US foreign policy. Now, this was on the heels of the new administration doing away with the global gag rule and restoring funding to UNFPA. But this statement was a signal that there might be more to come and that the administration was willing to take a holistic and proactive approach on these issues. The second is on leadership. It's obviously about the president and the vice president, but it's also about new leadership in Congress, as well as some new political appointees. In my more than 20 years of working on US foreign policy, it's the first time that the people in power in a range of decision-making seats actually represent a diverse set of leaders with a range of lived experiences, from the State Department to USAID to Health and Human Services to the Environmental Protection Agency. And externally, this White House truly understands the role it plays on the world stage. Earlier this year in March, at the annual UN convening on gender equality, the Commission on the Status of Women, the US sent the highest ever level representatives with Vice President Kamala Harris and US Ambassador Linda Thomas Greenfield as co-leads of the most diverse delegation in history to CSW. On resources, and we'll hear more about this today, although there are many more steps before it actually becomes law, the US House of Representatives, a key committee in the House, passed what the advocates consider a gold star bill. And this was with the leadership of longtime champion Representative Barbara Lee. The bill robustly funds global reproductive health and family planning programs. It doubles financial support for UNFPA, the UN Sexual and Reproductive Health and Rights Agency. It addresses the long-standing and harmful Helms Amendment, and it paves the way for a permanent repeal of the global gag rule, which I'm excited to talk more about today. On structure and accountability, we now have a White House level Gender Policy Council that's tasked with taking an intersectional approach to equity issues, both through domestic and foreign policy. And it requires engagement from all key federal agencies. And notably, it invites engagement and dialogue with civil society in policy and planning. So I don't have to tell this audience how urgent this work is, and also the outsized role that the United States has to play. Many of you likely saw UNFPA's latest State of the World Population Report focused on bodily autonomy. They found that nearly half of all women in the 57 countries that they surveyed cannot make their own decisions about whether or not to have sex, to use contraception, or even to seek healthcare. As UNFPA Executive Director, Dr. Natalia Cannon puts it, and I quote, "In essence, hundreds of millions of women and girls do not own their own bodies. Their lives are governed by others." So today we're going to hear from the leading advocates on efforts to strip away harmful US foreign policy, to restore essential foreign assistance and funding, and also re-envision what it means for the US to be a leader in advancing sexual and reproductive health, rights, and justice, champion gender equality, and truly center the self-determination of people to make decisions about their own bodies and their own futures. So let me turn to introductions, and I'm honored to be joined by Kelly Davis, Vice President for Global Birth Equity and Innovation, National Birth Equity Collaborative. Caitlin Horrigan, Director for Global Advocacy at the Planned Parenthood Federation of America. Moses Malumba, Executive Director, Center for Health, Human Rights, and Development, based in Uganda. And Lyric Thompson, Senior Director, Policy and Advocacy for the International Center for Research on Women. Thank you so much for taking the time to join us. And just before I turn it to the panel, two logistical notes. We will reserve time for our virtual audience to ask questions through the Q&A function. So please submit any questions along with your name and organization in the Q&A box. And please note that this webinar is being recorded. So let's get started. So let's start with an open question to all of the panelists. Clearly, there's momentum and some promising actions from this administration and Congress. And much of it is the result of advocacy from your organizations and other partners. So what are our biggest opportunities to not only reestablish the US as a leader on these issues, but really to push for transformational change, which is the bar that we're seeking? So Kelly, could I turn it to you first to get us started?
Sure, I'm really happy to be here, and what an exciting event. This question is a little bit of a double-edged sword when we talk about reestablishing the United States as a leader. I would love to posit that I don't know that the United States should be reestablished as a leader with its current human rights abuses, current racial equity issues, and current sexual and reproductive health disparities by gender identity, by nation of origin, and by race ethnicity. As a Black woman working on behalf of Black women and birthing people in the Americas, we can tell you that even though the United States is a hegemonic power, power and money are not the things that we aspire to when we think about leadership, right? So while we have this wonderful opportunity and things are certainly trending in the right direction when you compare it now to 4 years ago, there's still a lot of room for improvement. Seema, you mentioned the State of the World Population Report. And while it was key that we look at bodily autonomy for women and girls across the globe, there was still inside that report room for improvement, including only thinking of cisgendered women and girls as folks that receive coercive practices or are victims of state, community, and interpersonal violence. That was one area that needed improvement. Also, really thinking through the uncoupling of demography and population and sexual and reproductive health rights and access. So we really need a report on sexual and reproductive health and well-being, as opposed to tying fertility rates and anxiety about fertility rates, which really comes from eugenics and racist background, to United States, both domestic and foreign policy. So I do think there's a little bit of cleaning our own house first before we can really reestablish ourselves as a national leader. And cleaning our own house really requires having the descendants of folks that were enslaved via the transatlantic slave trade, immigrants, queer and trans folks, along with Indigenous people at the center of our advocacy.
Thank you so much, Kelly. And we will definitely come back to you to hear more about what it means to really focus on well-being and to make sure that the right people are at the decision-making tables, even on the community advocacy part. Thanks so much, Kelly. Caitlin, could I turn it to you next?
Sure, thanks Seema, and thanks to the entire UNF team for pulling together this important dialogue. It's really a pleasure and a privilege to be here with my fellow panelists. For Planned Parenthood, the top of our list that we're looking at this year on the policy front is around permanent repeal of the global gag rule. And we're proud to be working with so many partners in this global fight. And for us, we really see it as building off President Biden's action in January to rescind the policy, as well as decades of work in Congress. But most important, I think it's responsive to what we hear our partners in the field demanding and asking of us about what they want to see from the US government. So while I think it's unabashedly true that the world celebrated as Biden rescinded the policy with the presidential memorandum in January, we immediately heard questions from around the world about whether permanent repeal was possible. And I think that's really reflective of just how destructive that 37-year cycle of back and forth of the policy has been. And that failing to make the repeal permanent means that the policy's impact and the long shadow that it casts on the field is felt long after it's lifted by any given one president. So I think there are huge barriers that remain to building really lasting, meaningful partnerships and making sustainable progress on really a range of health and gender issues. So when we turn to Congress and look at what the landscape offers us this year, we really see a serious, narrow, but meaningful path to get this done and signed into law. Many of you will know the Global Her Act is the standalone bill that would achieve that. And just this month, we've seen bipartisan majority support in the Senate. We now have 51 Senate sponsors on the bill. And also earlier this month, we saw the House Appropriations Committee, chaired by, again, Congresswoman Barbara Lee, a longstanding champion in this space, advance a funding bill that would include the Global Her Act language. And this language has passed the last 2 years on the full House floor. We expect it will do so again. And we think we can get this language in the Senate bill as well. So we see a path, but we're not taking anything for granted. You can't these days, no change and expansion of rights happens without a serious struggle, which is why I think over 150 organizations have come together endorsing the Global Her Act. And when you look at the coalition, it's really bigger than just sexual and reproductive health rights and justice. It's groups working on a variety of global health issues, gender, LGBTIQ, human rights. And of course, it's bigger than just the US constituency. It's a true global movement and coalition. Just one example, last month, over 200 organizations spanning 88 countries across 6 continents released a statement urging permanent repeal of the global gag rule, and really informed by their experience on the front lines. So bottom line, I think, we see this as urgent and possible and are excited about what we could achieve this year.
Yeah, that's really exciting as part of cleaning our own house, as Kelly put it. Let me turn to Moses. Thank you, Caitlin. Moses, I think you're still on mute. There you go.
I'm now on mute. Thanks, Sema and the panelists, and thanks for organizing this important chat. I think one of the biggest conversations that has taken my attention lately is on decolonization. And I think for me, when you talk about the global gag rule and what we've seen in the past years, it's a huge opportunity for the US and other countries to think about some of the global policies and how some of the steps they take us back to the colonial era. I think it's a huge moment for everyone that is involved in making important decisions, to think about those very important steps that we need to take to avoid getting back to a colonial moment when we use resources, we use power and opportunities that we do have to really suppress rights, because this is what we saw in the past. It was during that time when we had a lot of repressive legal systems, very disenabling policies. We fronted religion at that time as the decision maker and the decisive sort of measurement for all the decisions that we are making. It is at that time when we established our education systems and health systems based on values that are not pegged to science. And I think that as we get into the new leadership of the United States, we need to revisit this and understand that actually, if we fail to look at things differently, we are getting back to the colonial moment. I also think that we cannot run away from the liberalization conversation and how this impacts on sexual reproductive health and rights. Where countries like mine citizens rely on governments giving, and the governments cannot give, and the NGO sector steps in. The moment you take away the space of the non-profits to provide, you're literally telling people to go to the private for profit. And I think these are things that we need to think about. And then lastly, very importantly for me, COVID-19 gives us a huge opportunity to reset ourselves, to rethink, to move away from just nationalism, to envision a future where we think about sexual reproductive health rights, not just as a national responsibility, but a global responsibility. Thank you.
Thanks so much, Moses. That's so well said. And we're going to come right back to you on the next question on some of the points that you raised. Thank you again, Moses. So Lyric, closing out this first question.
Sure. I'd love to weave all of those threads together, if I could, and say that as we're conceptualizing it, we think that a feminist foreign policy is the best next step that this administration can take to advance a transformative vision for sexual and reproductive health and rights and justice, and a number of other intersecting issues. It would join, if the Biden administration did this, now 7 other countries around the world who have done so, spanning from Africa to Europe to Latin America and North America, our neighbors to the north, Canada. And so we've done a lot of research and writing and thinking and advocating about what this would look like with many of the organizations who are part of this session. So thank you to all of you who have been coalition partners in conceptualizing this work and advocating for it. For us, we think that a feminist approach to foreign policy would do all of the things that you have just heard, everything from anchoring that looking at cleaning one's own house first, coherence between foreign and domestic policy, broadening the aperture, not just asking about what about women and girls, but taking a more inclusive and non-binary approach that would really look at power structures and how foreign policy has been a tool that has been in its history militaristic in nature, interventionist in nature, colonial in nature, and really think about how to use the tools that we have at hand in all of our foreign policy toolbox, from aid and trade to defense and diplomacy, and even areas that we don't necessarily always talk about in these spaces, like immigration. And using a power-based analysis to understand how past decisions have disenfranchised and withheld power from all of the populations that my fellow panelists have just spoken about, and how we can imagine new ways to engage in a more inclusive policymaking process that would correct for some of those injustices. So specifically on the sexual reproductive health and rights and justice portfolio, we have, of course, endorsed the blueprint, which I'm sure we'll hear more about later, and we're active in contributing to that vision. We fully support everything from the elimination of the harmful restrictions on US policies, gag, Helms, Hyde, past restrictions on PEPFAR, these sorts of narrowly defined decisions that are made in Washington that have real and severe impacts in terms of quality of people's lives in the places where we engage. We also, of course, are all about resources. Sweden was the first country to do a feminist foreign policy, and they have a handy mnemonic device that says rights, resources, and representation are generally a distillation of what the agenda is all about. For us, we would like to see actually even more and better resourcing for this agenda. We can talk about it a little bit later in the program, but I think there's been a solid first start in terms of funding for UNFPA at record levels, and a number of issues that are definitely due to be celebrated. The historic removal of Hyde is certainly noteworthy in this regard, but we have a long way to go. So happy to discuss some of those further issues further down the program.
Yeah, thank you so much, Lyric. And we will absolutely be coming back to you about this transformational approach of actually having a proactive feminist foreign policy. Let me come back to Moses. Just last year, a lot of us heard you testify on Capitol Hill to US policymakers. It feels like a million years ago when we were all in person together, on the extensive harm of the global gag rule for health services as well as human rights with the communities you work with in Uganda. Tell us a little bit more about what the situation is now. As Caitlin was noting, immediately partners are asking, when will this be permanently repealed? When will the shift happen? And we'd be interested in hearing your perspective on the state of play and how really, like you were saying, funding and US policy impacts communities around the world. The US is the only country in the world that has a global gag rule type policy. So why does it matter that the US actually be a proactive champion of sexual and reproductive health and rights? So over to you, Moses.
Thanks. I'll start with the last point that you made. I think the US has remained a global leader. And for countries like Uganda, where we are, this is historical. Right from 1962, when we had independence, I think it's around the same time when we had the first formal relationship between the US and Uganda on support. And to date, Uganda has substantially received aid from the US. I think the average that people are looking at is almost $1 billion that we keep receiving per year. Now, out of this $1 billion that we receive as a country, substantial amount goes to the health sector. Now, while we have known the US for supporting the HIV/AIDS work, I think it also supports a lot maternal health, family planning, contraceptives, and several other things. What is clear is that through USAID, for instance, we have developed plans, and the US Embassy at the country level has developed plans. With the current one, the Country Development Strategy Plan for 2016-2021, which came in just a year before President Trump came into power. Now, when you read that plan, you see very promising language where the US Embassy is committing to support increased access to reproductive health services and commodities, tackling a range of services on contraceptives, long-term contraceptive, permanent contraceptive, and a range of other methods, use of evidence-based tools like media to actually be able to clarify on things on contraceptives, and socializing and counseling that is very important for access to sexual reproductive health and rights. Now, the principles there, I think for me, were very captivating. When the policy talks about a more holistic approach towards collaboration, harnessing the youth and making sure that those approaches that harness the youth are very important. And then inclusive development that encourages gender inclusiveness, not just limited to gender and other factors, but also focusing on supporting work on developing Uganda and ensuring that the development is a Uganda context thing. So as a basis of that, the US, even before that plan in 2016, had been investing in Uganda, and quite a number of interesting things for sexual reproductive health and rights came up. For instance, the entire private supply chain for sexual reproductive health and rights commodities was a result of the funding that was coming from USA, and we cannot underrate that. Very many international NGOs, Maristopes and several others, are quite famous in the country for stepping into the spaces where the country is not committing sufficiently. On the other hand, we have substantially seen over the years that the government funding is very low. We are way below 15% as recommended by Abuja. Right now, it's even worse when COVID totally hit. So reproductive health funding has been really lagging in many cases. A couple of years back, the government was only able to provide 10% on reproductive health funding. And then the US funding would actually come in. This is amidst all the statistics. Past statistics, if you think about the COVID situation now, it's even worse. When you look at contraceptive access in the country was very low. I think we are among the country that has the highest teenage pregnancies, unsafe abortions contributing to almost 26%. What we see today is that all these statistics are actually getting worse because of the COVID situation, but also because of the gaps that were created when we got the global gag rule, when NGOs were closing up programs that we are supporting people, especially those that are in the rural areas. So if you ask me what the situation is looking like, I think it is too early to say that many of these things have changed. What is actually happening is a reset As NGOs, we have approached the embassy to find out what this new status actually means for us. We've not been receiving funding for a couple of years now from the US, and yet the work that we are talking about continues to be very important work. The policy and legal frameworks have remained the same. We had very progressive changes, very promising changes before Parliament, before Cabinet, and before the Ministry of Health that is working on sexual reproductive health and rights. Many of these stalled because the funding had been cut. Now, just as we are recovering and coming back to begin following these up, we then got a lot of lockdowns coming up, but we have also been in political activity. So in summary, I definitely think that there is a lot that needs to happen now. I think the situation has moved from the bad one that we had to even worse, where we have more violence, more lack of services. And it's very, very important for us to take stock on the gaps that we had when the global gag rule actually presented itself, such that the interventions that we think about are able to deal with the conditions and situations on contraceptives access. Again, the thinking has to move beyond just the politics. It has to also look at the new situation that COVID has posed to us. Thank you.
Thank you so much, Moses. And you really kind of showed us why it's so important that these policies don't flip-flop all the time. I mean, to really get to systemic change, we need to have this move beyond politics, as you noted. So thank you so much. Lyric, you began talking about the really incredible work your team at ICRW and colleagues have been doing on a feminist foreign policy, this transformative approach that we've been talking about. And as you mentioned, it goes beyond just aid. It's also about trade and security and immigration policy. What would it look like for the US to actually have a feminist foreign policy? And how can we help make that a reality?
Thanks for the question. So our methodology on this work has been twofold. First, a research-based effort that looked at the other feminist foreign policies of other countries to understand what they were doing and how they were defining feminist foreign policy. And then a really broad consultative coalition process involving hundreds of organizations and dozens of countries around the world to say, what do feminist activists and thinkers want to see in feminist foreign policy? And then trying to knit together a proposal that was both blue sky and ambitious and honored the principles and power of that vision, but also precise and something that would be understandable and digestible to some of our Washington bureaucracies. And so here is where we have landed with a definition, which was interesting to us, that until this work, there wasn't necessarily an attempt to define feminist foreign policy. There were various efforts that were being called feminist foreign policy, but we were concerned about the lack of a definition and sort of the appropriation of the term without a very clear understanding of what that meant. So if you'll hang with me, our definition is long, but I think very much rooted in several of the issues that we've come together on already in the course of this panel. So for us, feminist foreign policy is a policy of a state that defines its interactions with both states, but also movements and non-state actors in a manner that prioritizes peace, gender equality, and environmental integrity, enshrines, promotes, and protects the human rights of all people, seeks to disrupt colonial, racist, patriarchal, and male-dominated power structures, and allocates significant resources, including research, to achieve that vision. So that is the visionary and transformative kind of end toward which we are working. What would that look like in Washington? So we have both a whole of government proposal that is everything from a feminist policy council at the White House. We're thrilled that there is a gender policy council and also a policy council at the White House on race equity and inclusion, that would take this intersectional approach that doesn't, again, just ask what about women, but takes a broader and more intersectional aperture. And then we have a series of recommendations, agency by agency, stream by stream, and really that affirmation that this needs to be implemented in terms of both foreign and domestic policy. We're thrilled that the Biden-Harris administration is working on a national gender strategy, that they're doing that in tandem with the policy structures and leadership structures on race and equity, and that will have both domestic and foreign policy components. There's a resourcing element to this agenda, a monitoring and evaluation element to this agenda, everything from, say, in defense for these issues, taking, reversing the trans ban, which of course has been done, trying to take the investigations into sexual assault outside the chain of command, which the Secretary of Defense has expressed his support for, doing very intentional work on diversity, equity, and inclusion, which of course we have a new chief officer for that at the State Department, who's working on making the State Department less pale, male, and Yale. And then a number of resourcing requirements. We're asking for 100% of foreign policy spending to undertake a gender analysis, which USAID is congressionally mandated to do at this point, but there's a lot more work to be done for our other agencies. And we're asking for a 20% spend to advance gender equality as a priority in our foreign assistance. The US is actually quite low among OECD DAC donors in this regard. Canada leads the way. We're third from last. So there's a lot of ground to make up here. And actually the most recent appropriations were concerned, or most recent budget request by this administration were concerned that inflation adjusted, it's actually lower than the last Obama budget, and is actually for that principal goal of gender equality is even lower than the Trump administration's last budget request. Now, if you add different pieces, gender-based violence and other things, it's definitely a higher, better budget for our issues. That needs to be said. But we do think there's a long way to go on that agenda. Thanks.
Yeah, thanks so much, Lyric. And going back to Moses's point earlier, resources, the budget is symbolic for so many reasons beyond just the funding. So thank you for explaining that. So Kelly, I wanted to come back to you and the points that you made earlier. I mean, we've talked about this before, that there's such a long and rich history within the context of the United States on organizing for reproductive justice. And we've seen that at local, state, and federal levels. But US foreign policy is behind that curve. And there's a lot to be fixed, as you noted. Even in the context of prior progressive administrations, we've never had reproductive justice as the American approach to global gender equity, health, or for sexual and reproductive health programming. So tell us a little bit more about what it would really look like, and because you are an institution that focuses on centering reproductive justice in domestic and foreign policy, what does it mean in practice? What would the shift look like, especially for US foreign policy?
Well, that's exciting. That's an exciting question to ask, because as an organization really committed to Black mamas, their babies, and their villages thriving, we know that focusing only on laws or having a legalistic frame to transformation actually doesn't wind up with the most marginalized folks moving to the center or having better outcomes. There was a legal transformation in the 1960s, and yet when it comes to Black maternal health, it's more dangerous for me to give birth than it was for my mother to give birth to me almost 40 years ago. And so we see also widening disparities in sexual and reproductive outcomes as sexually transmitted infections, and even HIV within our nation. And some of these problematic practices and systems we are replicating through foreign aid. The kind of schism that says maternal health is over here, HIV is over here, and sexually transmitted, like contraceptive access is over here. We continue to fracture folks across the globe. And of course that hurts nations of color the most. So the reproductive justice framework really says we have to look at power in systems of power and rectify power imbalance. I think it's very interesting on this call. Of course, we think a lot about US foreign policy. We think also a lot about decolonizing like large philanthropic donors such as the Bill and Melinda Gates Foundation and the Buffett Foundation. But reproductive justice says, hey, how did we get here? Why do nations across the globe depend on, these three entities disproportionately for their sexual and reproductive well-being? And so really thinking about what Moses talked about, decolonizing, what that looks like. And it goes past kind of the feminist frame because it really embodies equity, analysis of power systems, and anti-racism. And so to what the Nordic countries presented about rights, resources, and representation, I would like to add reparations, right? So much of the sexual and reproductive health outcomes across the globe are caused by the extraction of people, resources, and wealth across the globe to benefit the nations that are wealthy today. So what does it actually look like to not be dependent upon the presidency of the United States for billions of dollars, trillions of dollars to be allocated, and say, what do we need to give health systems across the globe so that they can really access their true health and well-being? For us, one of the ways that that shows up the most is really thinking through the schism or the unilateral focus on abortion and contraceptive access as the main funded, the main advocated for policy agenda. And while dealing with Hyde and Helms and global gag rules are absolutely essential, so is ensuring that every person that gives birth across the globe survives, and not only survives, but thrives and is able to live the lives they dream about.
And that's really that well-being piece, Kelly. Thank you so much for illuminating those issues. Let me come to Caitlin. And you talked about global gag rule and the status there. And your team worked with many others to co-create the blueprint for sexual and reproductive health rights and justice, which you worked on during the Trump administration because you wanted to put into place a progressive vision that includes both domestic and foreign policy. And that feels like a theme today, that there's always been this false divide that of what we do within the context of the US is different than what we do outside, but actually it's all connected for better or for worse. And so, Caitlin, now that we have a progressive administration in Congress, where do we stand on blueprint priorities? What's coming down the line? And what's proving most challenging?
Thanks, Seema, for the question. I think you did a good job articulating at the top some of the early victories and progress that we've made with this new administration. And certainly there have been many in the first 100 days. But one that I would lift up that I think hasn't been discussed, which I think was important for the Blueprint community and beyond, is that in that early executive action that, rescinded the global gag rule, one of the things that was new and important was that it also put the US behind sexual and reproductive health and rights policy and advancement, both in the US and around the world. And I think placing it in that broader framework, and to Kelly's point, like there is still work to do on visioning what is included in that package, I think was important. And just to say that under the Obama administration, we really struggled with getting them to use even those words. They were not comfortable with saying sexual and reproductive health and rights. So I do think we're starting from a stronger standpoint with that foundational framework, and it gives a lot of room for advocates to then push and create accountability for what it means to show up for those issues in the US and around the world and help define for them what that commitment means. So just to say, I think there's a ton more work to do with that framework in place, building off some of the early progress that we saw. 3 areas that I've been thinking about is one, I think we still have key leadership gaps across the administration that are holding us back. There are roles like the ambassador for global women's issues and also the PEPFAR coordinator that have huge implications and potential to deliver for sexual and reproductive health, rights, and justice, but remain unfilled. And when we look at some of the early priorities articulated in the blueprint, there are things like ensuring that contraceptive commodities are available for purchase and use at PEPFAR sites around the world so that we can deliver integrated HIV and reproductive health care. And it's been really hard to get that, ask over the finish line without political leadership in place. I also think that there is still an immense amount of work to do when it comes to abortion and really understanding it in the context of sexual and reproductive health, rights, and justice, and making sure our leaders are both comfortable with articulating how abortion restrictions like the Helms Amendment cause harm to health and rights around the world, but also making sure that they're willing to take action and either put themselves behind ending these policies once and for all, or at least mitigating the harm where they also have the power to do so. And then finally, I'll just conclude by saying, I think, the Blueprint community was also really looking for sexual and reproductive health and rights to be more integrated across US foreign policy. It should not be the job of simply one, small office within US aid to lift up the totality of how people's health and rights show up in their lives. So while we've been pleased, I think, to see a variety of administration officials, articulate support for sexual and reproductive health and rights, I think there is an opportunity to look at some of these whole of government strategies like the White House Gender Policy Council strategy or the GBV strategy to make sure it's an integrated and cohesive part of those bigger sort of foreign policy vision documents and not viewed, as Kelly said, as sort of separate and something that is, happens over here in people's lives, but is a more holistic approach that really takes all of government to get done.
That's a great segue. So we'll do one more open question for all the panelists, and then we'll open it to questions from our virtual audience. So get ready with your questions. So we've talked a little bit about like the state of the moment and what some of the priorities are. What's next? Like what's needed to actually advance this bigger, more robust, transformative vision? What's needed across advocacy groups? Is there support from donor communities? How can we work better together? Let me turn it back to you, Lyric, to kick us off.
Sure, thanks. So I think the next steps for us and what's needed are two things. One, I mentioned that the policy piece is underway. So there's a national gender strategy that's happening now. I think we're optimistic about that. Certainly more so than the budget piece, which I realized I misspoke and said that it was just inflation adjusted. No, actually, this most recent request was actually lower than the lowest Obama administration request for gender and foreign assistance. But then in terms of the work that we're doing to build, to make bigger tents, to turn the mirror on ourselves and our coalition structures, to do the work of modeling the value of intersectionality and bridge building across issues and interrogating our own representation, interrogating our own history of our own organizations and movements. And that has been, I think, for me, the most gratifying part of the work on feminist foreign policy is that has coincided with such a deep reckoning in our movement and has afforded opportunity to learn from so many groups who are doing work, whether it's on reproductive justice domestically, on environmental justice at home or abroad. The nuclear policy groups have been a part of this, and it's been a learning process about that. And that really the power of intersectionality as a frame to drive a movement that is bigger, more representative, and more powerful to demand change on these issues.
Yeah, I couldn't agree more. I mean, having a better movement in the long term is going to be as impactful as the work that we're doing. So thank you, Lyric. Kelly.
Budgets are moral documents. And I think the imbalance of only thinking about abortion or contraceptive access continues to harm the bounty of sexual reproductive health, rights, and well-being concerns, particularly for people who are capable of pregnancy throughout the world. We must continue to hold governments that continue to benefit from the exploitation, colonialism, and slavery accountable to actually supporting the countries in which they colonized or stole from, particularly not, Britain, France, Portugal, and all the Western nations in the United States. And then we actually have to listen to the most marginalized people. We ask folks to quantify like how many LARCs or long-acting reversible contraceptives did you place in, but we never actually asked about the context of their lives in order to make foreign policy. Oftentimes, the folks that we are hoping to benefit are not making decisions in Washington, and we need to remove the middleman. Those are the very folks who need to be deciding the policies and practices that their nations need in order to advance sexual reproductive health, rights, well-being, and justice.
Thank you, Kelly. Yeah, we have to recognize that we don't have the answers for other people's lives. Caitlin.
Sure. Maybe speaking a little bit directly to our donor friends on the call, I think, it's obvious, but I think it bears worth saying that we need continued investment in our advocacy. even with this more favorable political environment, I think we will not make progress. And certainly the Trump administration dug us into this huge hole. But things were never that good. Needs were unmet, populations were left behind, and people were not at the center of our policymaking. So I think if we're going to both undo the harm of the last 4 years, but really move forward to the world that we all want to create, we need sustained investments in our advocacy work. I'll also note that many of you engage in your own bilateral conversations and have access to power and players across the US administration and in Congress. So really encourage you to prioritize these global sexual and reproductive health rights and justice issues, both publicly and privately, because I do think it's important for those decision makers to hear directly from you and not just your grantees, and for us all to be amplifying the same message. And then in terms of picking up on what some of my colleagues have mentioned on diversifying the movement, I think donors, often have very diverse grant portfolios, and you could help us, I think, continue to build a big tent of allies who are working on behalf of sexual and reproductive health rights and justice, and pull in a broader constituency of folks who can see us, some big and transformational wins. And I think to the broader audience who's tuned into the webinar, I do think we need ongoing help socializing the notion that some of these changes are urgent and that they are also winnable. And I think both are important because I think there's a risk, because we've had some early successes with the administration, that people feel like, the box has been checked, we've done the gag rule, we've refunded the UNFPA, and that the work is over. And I think we need to keep up the pressure and momentum to say that that's not good enough, and that we need to see through, bigger game-changing progress. And winnable and possible, I think, is important to shift the mentality of our collective imagination, because we're so used to a policy like the global gag rule being this inevitable back and forth across administrations. And we need to see that, with political will behind it, that doesn't have to be an inevitable reality around the world. So, I think driving forward that this is possible and this is urgent message is so key, and so many people have a role to play in that work.
Thank you so much, Caitlin. I've heard one of your colleagues say that people's health and rights should never be up for debate. So that's well said. Moses, closing thoughts on this question about how we actually get to this transformational vision.
Thanks. I think first, for those that need the services, the transformations, they won't wait for transformations to happen. So I think the most important thing is to ensure continuity of services. And there are quite a number of tools available now, even in the difficult days like COVID-19. How do we catalyze on innovations that, like self-care? How do we ensure that self-care is continued as much as possible to reach those that are most in need? That's one. Two, how do we continue the harm reduction models? They won't wait for laws to change. If we can work within the existing restrictive laws, how do we oil those processes to ensure that they work much more? And then for us doing advocacy in that perspective, how do we ensure that we hold the governments accountable much more with even the limited resources that are available as we wait for the other resources to come? For the donors, I think that it's now much more seen that flexible funding is very important. I think flexible funding that gets to the unknown, is extremely important in these moments, because you plan for this and next week it's that, and the next month is the other. So making funding as flexible and making sure that that flexible funding reaches the grassroots groups is extremely important. And then lastly, the point on movements is extremely important. I think we need to build our movements, not just within the spaces where we are, but also across the spaces in which we are working. As we work virtually, we are benefiting much more through working with partnerships of people who are outside the spaces where we are. Thank you.
I think you saw us all nodding our heads vigorously, Moses, on the piece around flexible funding. There's been so much news about that right now, about just trusting people and trusting institutions to do the work. So thank you so much. We're going to start turning to questions from the audience, and the first one's from Moses. And if others have questions who are tuning in, please continue to put that into the Q&A box. So Moses, from a colleague at another institution in Uganda, the question is, With the revival of multilateralism and global health cooperation by the Biden administration, do you think we will witness a revitalization in global commitments to support SRHR services globally in areas with poor health indicators and chronically underfunded health systems like in sub-Saharan Africa?
Tough question. I think usually global commitments and the way they translate back to those that need to access services, there's always a mismatch. But it's a good sign. In my view, I think it's much better than the past situation where we didn't even have the commitments, but what we had was, populism and radicalism. I think the fact that we have moved away from radicalism creates a sense of hope, not just for those that need the services, but also for us that are involved in the work. And for us that are doing advocacy, those commitments are tools that we use to hold our governments accountable and the embassies accountable. Because if I have those commitments, then I can move to the US Embassy and say, you're planning for this and this under this program. How do we make use of this? So I think they have value, but we have to make use of them as tools.
Yeah, thank you so much. That's the accountability piece again. If you have a public commitment, you can make noise about it. So going back to, this is the question I think for the group, but I might start with Kelly, which is, how do we truly make sure that we are creating a movement where the people closest to the issues are in the driver's seat of decision-making, design, resource allocation, which is so important. We've heard about that, accountability, so that our movement actually represents the work that we're trying to do, as many of you have already said. So Kelly, if you can kick us off on that.
We've heard a lot about how philanthropy and foreign aid need to be decolonized. And this is one key way processes really actually engender kind of racist practices and racist histories, right? So oftentimes we hear when it comes to funding grassroots organizations, particularly Black women or led organizations, indigenous organizations, Asian-led organizations across the globe is they can't take the risk, right? So folks, program officers, executives within philanthropy, even our own representatives within our own government feel like they can't take the risk for even small amounts of money because they fear corruption or the inability to show return on investments. And what we're saying is actually that's part of a racist framework, because white-led organizations have corruption, they lose money, they duplicate resources all the time, and we don't bat an eye when it comes to writing millions of dollars worth of checks. And so it has been slow going, but I have felt very encouraged, particularly in the year since the senseless police murder of George Floyd here in the Americas, that I see philanthropic organizations, I see the US government taking a look at its policies and practices, including but not limited to sexual reproductive health and rights, to really think about how can we fund the folks that are on the ground, the folks who actually understand, because they're, as long as we continue to fund large INGOs, large NGOs, we actually are not able to be flexible and responsive to the daily needs of people who are more than likely experiencing the worst of oppressive systems and the worst outcomes. So I really actually am encouraged, but the change has been incremental, right? We hear folks taking small amounts of money to work with grassroots organizations, but in our work to decolonize, particularly sexual reproductive rights related to contraceptive access and abortion, while ignoring things like maternal mortality, maternal morbidity, breastfeeding, all the things that are comprehensively around sexual reproductive health rights and justice, we see movement in the right direction. It's just, a little bit too little too late, but we're gonna get there.
Thank you, Kelly. Let me turn it to Lyric, and actually we have a follow-on question. So let me turn to Lyric and then I'll ask the next question. Go ahead, Lyric.
Sure. Just to briefly say that I'm grateful for this question, because I think it's a really important part of the push that we're doing on the Feminist Foreign Policy campaign. I think in terms of what progress there has been dating back to 2010 and USAID's USAID Forward initiative of them trying to do a little bit more localization and procurement and partnering with local organizations. I think the target that was set was to increase the level of funding that was going to local partners from 10% to 30%, a target that's never been met. And that was irrespective of what kinds of local partners that we are working with. Our vision is to do something along the lines of Canada's Equality Fund, which took the development assistance monies and parked it outside of the actual government contracting process, handed it over to feminist funds and gender lens investors to manage that money, grow that pot, and then invest in feminist, women-led, and LGBT-led organizations as a core goal and strategy of their foreign assistance. That's certainly something that we want to see more of. I think it jibes really nicely with the sort of trend line of localization. And certainly this is something that we heard from Administrator Power in her confirmation testimony that is of a key interest to her. The New York Times editorial page had a piece on decolonizing aid and what that would look like. So I think it's really a moment where we can propose some innovative ideas on this. Thanks.
So Lyric, you actually answered the next question, but I'll just state it so people know what people were curious about. Is that, has there been any movement forward on having money, US money appropriated, go directly to local community-based organizations and NGOs and not flow through INGOs? So you started that answer with USAID Forward. And the point the person was making is that this is a bigger issue in US foreign assistance, but maintaining that structure and that distance is likely to serve, getting away from that structure is likely to serve local needs. So thank you for starting to illuminate that. I'm going to continue with the next question. And just to say, look, I've heard you this at another event, like the how is just as important as the what. So you talked about that there's a different how that's out there. And there's actually a model from Canada. The other piece is, again, kind of staying on this note, is how do we strengthen the SRHR movement across the globe, whether it's within the context of the US or in other countries, so that we have a committed and consistent movement that actually monitors foreign policies and its impact on local populations. I think we've discussed that to a certain extent, but would anyone like to weigh in further?
Can I say a thing?
Please.
So I think creating movement is one of the most beautiful thing, but most complex thing, especially across, because we are diverse, and sexual reproductive health and rights is even much more diverse. A few weeks ago, I was in a meeting on movement building, and we are trying to create intersections, and we are very, very diverse. I think what is very important is for us to create those discursive spaces. Spaces that enable us to establish the things that bring us together. What are those things that bring us together and make us one, such that we do capitalize on them to help us move away from isolation of working on the small coalitions that we do have, you're working on abortion, LGBTI, or this and that. So things that are bigger and bring us together, and things that are facing all of us. We usually call them contested issues. In a way, they are contested in societies differently. So I think that the beginning point really is to create those discursive spaces. Once we create the discursive spaces, we identify the things that, that bring us together, and we use those as things that can combine us and work together with a lot of trust. Yeah.
Thank you.
I would just like to add to Moses' point that I think that it's happening, right? The only silver lining to the Trump administration in the SRHR space is that it did help us eliminate silos. 5 years ago, would folks dealing in reproductive justice provide like testimony inside to UN committees? And I'm looking here on this call, and already we have working relationships as the National Birth Equity Collaborative rooted in reproductive justice with PPFA, with ICRW, with a whole host of folks that I don't think 5 years ago was not the case. 5 years ago, a lot of the white-led reproductive rights organizations did not talk about anti-racism, did not actually look at their hiring policies and practices, did not look about how they were talking about people of color in their publications or their research, right? So in many ways, we're still at the beginning, but it started by understanding movement spaces, the different movements that contribute to sexual reproductive health and well-being, beginning authentic partnerships, right? And cleaning our own houses as institutions to rid ourselves of the very isms that actually we perpetuate on the global stage.
Thank you so much, Kelly. I couldn't agree more. Did you want to comment, Caitlin or Lyric? We can also move to the next question.
Sure, I'll just add a brief remark on the movement building thing. I think the challenge of this era will be flipping the switch from the top-down mentality to really have a global movement, but that's driven by the local level. And I see so many opportunity. I know we felt it even within the Planned Parenthood family. There is so much to learn about the innovative ways that progress is being made in really challenging settings around the world. So, you know, when our folks in Missouri get to hear about how colleagues in Ecuador and in Kenya and in Ireland are making progress on tough reproductive health issues and really winning on longstanding fights. There's so much to learn as we face our own challenges in the US and think about how we innovate and do better. So I think as we build a movement, it's really figuring out like where can the global movement be in support of the good work that's already happening on the local level, and not where can the global movement somehow create something because it's already there indigenously happening in the communities who know best about both what they need and how to get it done. And it's just how can we as a global movement, I think, be supportive of amplifying the good work that's already existing on the ground. So I feel like that's one of the challenges of this era, to really try to get that dynamic right.
Yeah, thanks so much, Caitlin. And it's really important to hear that perspective from a large institution like Planned Parenthood Federation of America. So thank you so much. I'm going to shift gears with a different type of question, which goes back to the US political system. And the question is, you know, we have this kind of potentially stars aligned moment where we have pro-sexual and reproductive health and rights allies in both chambers of the US Congress and a supportive administration, but we do have a midterm election coming up next year. So what happens if we end up with a Congress that is not a majority in support of these issues? I don't know, Caitlin, if you want to kick us off.
Sure, it's an important question. And I think that's one of the reasons why we're feeling so urgent to not wait on where we can make progress and to really push through as much meaningful change as we can. I mean, reflecting on lessons from the early years of the Obama administration, where we found ourselves in the same position. You know, some big things got done, but a lot got left on the table, and those were squandered opportunities to really make big change happen. And so like these 2 years are the operative moments to change a lot. And if we only get so far as resetting to where we were before, I think that will be a big disappointment. So I think we do have to push through as fast and furious as we can in this period before the US election cycle, you know, clamps down on people's ambition and vision. And of course, like practically post may change the vote count about what is possible. So I think, you know, it's an exhausting but an exciting time to really try to get as much as we can in this early period, and hope that we still have a favorable atmosphere. And for those of us who have political hats, obviously fight to make that a reality post-election. But I do think in terms of policy change, this is our biggest chance to really move the ball forward.
Thanks, Caitlin. And I'm reminded, it sits in my head, the comment Moses made that the services need to continue no matter what. Anyone else would like to comment? And we're going to do one last question and then move to closing. Our time has gone by quickly. Okay, I'm going to move us to the last question from our audience, which is, we just had this major global moment of the Generation Equality Forum, the second one that happened in Paris, and a question on how, reflections from the panel on how the United States showed up in that space. So Lyric, I might turn it to you to start.
Sure. So thanks for the question. Having spent, thought we were going to spend 6 months planning for this thing, and then we got 18. We were delighted that, of course, there was a US administration that did show up to the forum, at least to the Paris one, I should say. They didn't show up to the Mexico one, which we were a little nervous about, but I think was more a virtue of timing. That was in March. And there were some questions about who's in seats and who could attend and what would we say when we got there. So those questions had been largely answered by July, which is when we had the Paris Forum, June 30th to July 2nd. We were asking, along with a number of the organizations on the call, for a number of things. One, high-level US delegation to Paris. That was achieved. It was led by Vice President Harris, who made interventions on the opening ceremony. And then there was a robust delegation of additional high-level political officials peppered throughout the 3 days. We heard from both White House Gender Policy Council co-chairs. We heard from Administrator Power, Barcera, others, Ambassador Thomas Greenfield. So this was, I think, a strong showing that the US values this kind of forum. And it was, I think, an interesting and innovative and in many ways feminist space, because we were doing this forum outside the intergovernmental process, because we were not confident that we could get to where we were in 1995 in terms of government negotiated agreed language on our core human rights. Travesty. However, what do feminists do? They innovate, they design spaces where you can co-create a new platform among civil society, government, international organizations, and the private sector. The US has released a fact sheet with reams of commitments that they made on 3 of the 6 action coalitions and did join the Women, Peace, and Security Compact. Most of those were not necessarily news to the forum if you had been following appropriations, executive orders, and things. But I think it was a really solid showing by the US that we care and we're going to show up to these things. I was surprised they didn't make commitments on climate technology. They unfortunately did not announce a feminist foreign policy as part of the feminist movement and leadership action coalition. So that's our work for the fall.
Thank you. Robust answer. Anyone else like to weigh in on the Generation Equality Forum?
I will not talk about the US, but the Ugandan experience. We clearly followed it up. It was interesting how the government made commitments much less than it made in 1995, and how it's very comfortable to talk about women empowerment and other things, but not bodily autonomy and sexual reproductive health and rights. So we don't know what this means, but it speaks quite volumes. Even when as civil society, we worked as a coalition and proposed language on things that we think are important on bodily autonomy and sexual reproductive health and rights. Much of this was not taken on board. So I think, but it provides opportunity. The fact that UN Women at a country level was mobilizing and the government was a bit responsive amidst the difficult times of COVID-19, there's a bit of opportunity that we need to tap into to ensure that we don't lose the bigger picture.
Thank you for weighing in on that, Moses. I was hoping you would. So we're at our closing. And what I want to do for the closing is have one final question for our panel. And so we've had a really robust and rich discussion about the challenges, opportunities, sort of the new vision that we're all collectively hoping for so that we can actually have transformational change through our foreign policy on sexual and reproductive health rights and justice. So what's the one thing you're most hopeful about for the future of our movement? And Kelly, I'll come back to you to start us off.
I'm most hopeful about moving just from service delivery and legalistic frameworks to one of justice, which really thinks about the whole individual outside of whether or not they want to become pregnant.
Thank you. Moses.
I think for me, the whole fact that we are talking about sexual reproductive health and rights, not just as a national issue, but a global solidarity issue, continues to energize me all the time. And I think it creates a sort of bright future that it's one thing in the world like COVID-19 that brings us together. So that global solidarity will continue to be something that is very important to even tackle the most pressing local issues in the context where I work. Thanks.
Thank you so much, Moses. Caitlin.
Thanks, Seema, what a lovely question to end on. I'm really enjoying my colleagues' responses. I'll answer it quickly on two fronts. I think from a movement perspective, I'm most hopeful about the long overdue push to, I think, center equity and really reimagine how we work together. And I just think it's so exciting to think about what we can achieve and also learn from one another if we fully embrace the global movement that I think we've all been talking about and really put people at the heart of our policymaking and work. And then on the policy front, I'll end where I started. I think I'm hopeful that we can finally end the global gag rule and really stop this destructive cycle that has plagued the field for so long.
Thank you so much, Caitlin and Lyric.
I'm similarly hopeful about the transformation of the movement and the way we're doing our work. I think hopeful that it lasts, that it's not something that people just do while donors are asking questions and then move on when George Floyd isn't in the news all the time, or when the kind of the moment passes, as press moments inevitably do. I'm also, I think, hopeful that we are able to sustain the policy focus on our issues that has been occasioned by the pandemic after that too passes. Obviously, with the Delta variant and everything, we're not in any position to be to really be imagining a post-pandemic future. But I think these two reckonings happened at once, where they put issues that many of us have cared about for a long time front and center, and have done a better job of shifting the policy landscape and reorganizing the advocacy apparatus in a way to respond to those issues. And I'm just hopeful that this is the new normal and not a temporary glitch in the system.
Thanks so much. And it was nice to see so much joining in the answer in terms of that common vision. And I'll just answer myself, which is, I mean, this hearing from all of you and having the privilege of working with all of you and your institutions gives me great hope. And I also agree that I hope that this is the new norm. I think it's a good way to put it, Lyric, that that our movement, our community, sustains and grows and continues to become enriched so that we can actually do better work together. So thank you so much for sharing all of your time and your expertise and your honest reflections on the state of play with us. Thank you to the audience for being so engaged, and please stay in touch. This is just a moment in time as we continue this conversation, and we look forward to continuing to work with all of you. Thank you again for joining us today.